Hi everyone, welcome to researchmd.com. We're going to have another great presentation today. A few weeks ago we did a presentation about carpal tunnel syndrome and teaching you about pathophysiology, what are the management. In today's presentation we're going to look at the alternative treatment and look at the scientific. All our presentations are based on science, okay? If there's a scientific study, we're going to recommend it. Otherwise, we will not recommend or will not do any presentation if there is no science behind it. ResearchMD is all about science. Again, my name is Pramil Cheriyath. I teach medical students and medicine residents. I'm a program director in internal medicine residency, transitional residency. I'm a director of research, and I also an assistant professor of medicine with two major universities. So let's, again, our topic today is yoga beneficial for carpal tunnel syndrome? Okay. Now, what is carpal tunnel syndrome? Just a brief introduction. It's a compression of the median nerve at the wrist, numbness, tingling at the thumb, index finger, middle finger. Those are the main symptoms. Now, what is yoga? Yoga is a practice. It was started in ancient India a long time ago. It includes breath control, meditation, and some special postures. So we did some research, and we found this nice scientific study actually published in JAMA, yoga-based intervention for carpal tunnel syndrome. And we're going to look into that. So objective of the study to investigate the beneficial effect of the yoga in relieving the symptoms of carpal tunnel syndrome. Design of the study, this is a randomized single-blinded study, okay? And the yoga intervention, they got this, so many pauses, we kind of put it in there. You can kind of go through and see which one. So they have, I think, almost like 11 to 12 yoga poses for the carpal tunnel syndrome. And they put both into group one. Group one, there was the patients were like they were using the splint and the current treatment, okay? In the group two, they were doing this yoga exercise twice weekly for 8 weeks. So all the yoga exercise we talked about in the previous slide. So two groups, the one group just wearing the regular splint and the regular treatment, and the yoga exercise in the group two, they were just doing yoga exercise twice weekly for 8 weeks. So the time course, they did the study for the 8 weeks, and then they measured the outcome. What outcome they were looking at? One is the grip strength and the pain, intensity of the pain, and then sleep, and they looked at the Fallon sign and the Tinel sign, and they looked at the median nerve motor and sensory conduction time. These are the outcome they looked at it. So the results, when they did the analysis, they found there is improvement in grip strength and improvement in pain, but no improvement noted in the median nerve conduction time. So definitely there was improvement in the grip strength of the patient. There is improvement in pain. So what are the strength of the study? Again, this is a randomized study that tell us like a lot of things published in JAMA, single-blinded randomized study. So very strong study, okay? So in conclusion, based on this scientific study, yoga exercise does help in improving the symptoms of carpal tunnel syndrome better than putting the splint. Remember that. Yoga, based on this scientific study, yoga exercise does help in improving the symptom of carpal tunnel syndrome. Thank you so much for watching. We'll be back with another study. Please subscribe to our channel. It would be greatly appreciated. Thank you.